Our question is, how do we know that racism is affecting the health of people, all people in our country? I believe one of the things we're seeing, and particularly in primary care, is an increase in anxiety disorder and those pathologies associated with it. Hypertension, poor health choices, lifestyle problems, obesity, binge eating disorder, these kinds of chronic problems that we can no longer afford as we're also beginning to have economic stresses on our healthcare finance. We have a campaign pushing back against the government or the Centers for Disease Control and Prevention to force them to do what they're empowered to do, which is prevent and control disease for the public. I believe racism meets that 4 criteria that they have for that threat, and we're trying to ask them to do their job, particularly now that we have evidence that it's directly related to everyone's health, not just the health of people of color. So CDC has 4 criteria for what constitutes a threat to public health. One is that it's a burden. It's an economic burden on the culture. The second is it's disproportionately shared by a section of the population, whether that be female, gay, pregnant, smoker. But the other is that it shows that current measures are not enough. So in other words, that problem is continuing despite what's being done currently. And the last one is that there's evidence that upstream change will affect that problem. In other words, institutionality, the institutional problem of it. What we're saying is racism meets those 4 criteria. So we are asking that CDC do their job, declare it a threat to public health, and then follow the protocol just like did for other public health problems in the past. Zika, HIV, smoking, diabetes, these other campaigns. The way that we want to do that is it needs to be effectively, definitively, and publicly announced as the threat that it is. That way, people can then begin to speak about racism and less about health disparities, social determinants of health, these other code words that have currently been used. We are saying if CDC will do that, we will begin to save the disproportionate number of healthcare dollars, lives, unfortunate incarceration, gun death. So much of the underlying cause will be mitigated, and that money will be saved and put into education, healthcare, the kinds of things that we now know have been neglected instead. Because in primary care, the idea is not just to treat the symptom, we pursue the cause of the symptom. It seemed only reasonable to apply that to this particular inequity. As time has gone on, we've begun to see more and more how that same underlying cause, racism, also harms people who are not marginalized, people who are not targeted by these inequities. We want equity, health equity for our entire population, and for CDC to recognize those 4 criteria and realize it's not a mental health problem, it's not a political problem, it is a public health problem. Handle it.